हेलो एवरीवन, हम लोग बात कर रहे हैं साइकोलॉजी के क्वेश्चन आंसर की। इस वीडियो में हम देखेंगे डिस्क्राइब द नेचर एंड स्कोप ऑफ साइकोथेरेपी, हाईलाइट द इम्पॉर्टेंस ऑफ थेरेपेटिक रिलेशनशिप इन साइकोथेरेपी। आंसर: Psychotherapy is a voluntary relationship between two people, one who seeks help and the other who is ready to provide the help. The therapist. It is given under therapeutic condition, whereas psychotherapeutic approaches have the following characteristics. All psychotherapies are systematic application of some theory or principle of different therapies. Only trained professional can practice psychotherapy. Therapeutic situation is a two-way process in which therapist as well as client actively interact. Psychotherapy functions under formation of therapeutic relationship which is confidential, interpersonal and dynamic in nature. Psychotherapy has a very broad scope to deal with disorders which are as follows: reinforcing clients resolve the betterment, lessening emotional pressure, unfolding the potential for positive growth, modifying habits, changing thinking patterns, increasing self awareness, improved interpersonal relation and communication, facilitating decision making skill. Becoming aware of one preference in life, development of adaptive behavior, therapeutic relationship. The special professional relationship between the client and the therapist is known as therapeutic relationship or alliance. There are two major components of this relationship: the contractual nature of the relationship, in which two willing individuals, the client and the therapist, enter into a partnership which aims at helping the client overcome his problem. Second, limited duration of the therapy. This alliance lasts until the client becomes able to deal with his problems and take control of his life. Through therapeutic relationship, the therapist wins the trust of the client. The quality of this relationship alliance determines early healing in psychotherapy. Question number 2. What are the different types of psychotherapy? On what basis are they classified? Following are the main psychotherapies: psychodynamic therapy, behavior therapy, humanistic therapy, or existential therapy. Parameters of classification are as follows. What is the cause of the problem? Psychodynamic therapy, intrapsychic conflict, id, ego, and superego, causes problems. Behavior therapy, faulty learning of behaviors and unrealistic cognition, thinking process cause problems. Existential therapy, answer about the meaning of one's life and existence is not available. How did the cause come into existence? Psychodynamic therapy, intrapsychic conflict are caused due to unfulfilled desire of childhood or unresolved fears, which cause fixation and repression during psychosexual stage of life. Behavior therapy, faulty conditioning pattern, faulty learning through improper rewards, faulty thinking and beliefs. Existential therapy, current feelings of loneliness, aimless of life and meaningless existence. What is the chief method of treatment? Psychodynamic therapy, free association and reporting of dream to make the person confront and resolve the conflict. Behavior therapy, to identify faulty conditioning patterns and faulty learning and to challenge the faulty thinking pattern. Existential therapy, providing positive, non-judgmental and accepting therapeutic environment. Therapeutic Therapists act as a facilitator, helping client solve his own problems and arrive at solution through personal growth. What is the nature of therapeutic relationship? Psychodynamic therapy. Therapist understand the client and is more capable in interpreting his thought and feelings. Behavior therapy. Therapist is able to identify fault. Behavior therapy. Therapist is able to identify faulty behavior and thought patterns and is capable of finding out correct behavior and realistic thought patterns. Existential therapy. Therapists provide warm and empathic relations, helping the client feels secure to explore the cause of his problem himself and herself. What is the chief benefit to the client? Psychodynamic therapy, emotional insight to resolve problems. Behavior therapy, adaptive and healthy behavior and thought pattern to reduce stress. Existential therapy, personal growth by increasing understanding of one's aspirations, emotions, and motives. What is the duration of treatment? Psychodynamic therapy, classical psychoanalysis lasts for several years, new version 10 to 15 sessions. Behavior therapy, short and completed within few months. Existential therapy, short and completed within few months.